Let's talk now, though, to Alan Lofthouse, who's Deputy Head of Health at Unison, because a story came across our desk just the other day. High numbers of staff are leaving emergency call centres, those people that answer those 999 calls, because of high pressure, a lack of support, verbal abuse, long shifts, low pay, and, of course, the ambulance problem, which I'm sure doesn't help. Very good morning to you, Alan.
Good morning, Mike.
Nice to talk to you. Call handlers get so stressed they took an average of 33 sick days a year between 21 and 25. That's about 5, maybe 7 times more than your average. So what's going on?
Well, we're trying to shine a light on these really difficult jobs that workers do in call centres across the country, responding to the calls from the public, from your listeners, when they need an ambulance or they want advice or they're worried about a relative. And really what we're trying to highlight is that these jobs are so pressured and there's not enough support there for staff. You think about, they take a call, they deal with some of the most difficult situations that you're ever going to face in your life. Put the phone down. The phone is ringing because it's constantly ringing because our 999 services are overwhelmed already. They pick up another call, they deal with another patient, and there's just no time between calls, no time to decompress, no time to think and process what you've been through. And this is just leading to this incredible turnover rate of staff, where we're seeing, you think about that over 3 years, an average of nearly 30% of people, 1 in 3 people are leaving every year. And in some of them, it's 80%. 8 out of 10 people leaving a job. And it'll be a job that they love. It'll be a job that they really want to do because it's a really rewarding job. But it's also a really pressured job. And I think it's time to shine a light on some of these really challenging careers.
I mean, what sort of training do they get before they get to actually have to answer the calls?
Yeah, I mean, they're incredibly well trained. They go through, a whole series of weeks of training before they take calls. But what you get with a job is the training and then the experience. And of course, that experience leads you to understand the job, understand the patients you're dealing with better. So they're highly trained, highly skilled individuals. And their pay is only just above the national minimum wage. And that's, pay isn't everything, is it? You can't just stay in a job because of pay, and people aren't attracted to working in the NHS or the ambulance service because of pay. But when their wages are just above the national minimum wage and they can get equivalent wages in a supermarket, why would they stay in an ambulance service answering calls, being screamed at, shouted at, demanding public, and situations where they're trying to help people in, like I said, those really difficult situations. They're listening to people who are with someone who's dying or has died or traumatic, and they can't do anything to help. I'm an ex-paramedic myself. So at least when I got there at these emergencies, I could hands-on help patients. I could take them to hospital, had something to do. Some of these call handlers are taking calls from people. They're giving advice. They're telling people how to resuscitate family members or friends, but they can't do the thing themselves. They've just got to go with it. And people, of course, distressed. So, money's only one part of it. We're also calling for greater support because there is much more that can be done to give staff the support they need, to try and reduce those sick days, to try and prevent that turnover, because economically it doesn't make sense to just keep churning through your local population.
When you say support, like what is it that you're asking for then?
Well, we want better occupational health support, better counselling services, often ambulance services, and look, we've got some really good examples. We're not here bashing ambulance employers necessarily, but we're saying, well, clearly it isn't enough, and clearly it's not quality enough. So it might just be a regular counsellor that you can phone up, the sort of thing that anyone can get in any employer. So you phone them up and you get 5 counselling sessions, and then after that, it pretty much stops. Well, you're talking people who could have some serious traumatic mental injury from the things that they might have heard or processed. So there's got to be a greater understanding that these aren't machines doing these calls.
They don't have someone they can talk to about that?
I mean, they ambulance services do have access to occupational health support, but what we're saying is the quality of that support needs to be better. It needs to be dealing with some stuff. It can't just be general counselling. Right. People can end up with things like post-traumatic stress disorder from doing these jobs. You often think it's only those people who respond in the ambulances or army personnel, but it's that thing of you're helping somebody and yet you can't physically touch them. All you can do is try and provide them advice. And you imagine giving advice to a mother on how to resuscitate their baby, and then that call line goes dead, and you don't know then what's happened. And then next thing you know, you picked up a call to somebody who's abusive, who wants a taxi ride home from the pub. And it's that kind of shock between those two things that creates that mental challenge for people. And what they want is support from their employer. You know?
How much more difficult is it now that ambulances are in such short supply that you can't actually get ambulances to an awful lot of people? And people tell me all the time that they've had to wait 9 or 10 hours for an ambulance, or, you know, they haven't been able to get one at all. You know, that must be difficult as well if you can't actually allocate an ambulance.
That's a really good point, Mike, because, you know, what the public want is an ambulance quickly to them, and that's really what they should expect. But we know that that's been declining over the last few years. You know, ambulances are queuing outside hospitals. They can't respond in the community. So that means someone there is holding risk, and that's your call handlers. That's the ambulance control centres that are holding the risk in the community. And that means people phoning up and saying, well, where's my ambulance? You know, my dad's on the floor. And they're trying to say, well, yeah, but we're dealing with a car accident. Somebody's had a cardiac arrest. We want to get to your dad, but we don't have an ambulance. And people get frustrated. People start to shout. People are abusive. And that's another thing that we're calling for. There's been quite a lot of work to make sure that the ambulance personnel who are going out there, they face a level of violence and abuse, but call handlers do as well. And often it's very difficult to say, I'm going to put the phone down on you because you're racially abusing me, you're shouting at me, you're saying sexist and horrible things to me. But that still something needs to be done with those things. There needs to be some penalty for people who can't use the service, and understand that it can't be everything for everyone at all times. So, yeah, I think reducing the pressure on staff also goes to dealing with those abusive callers. And if you've ever watched any of those shows, you would have heard them, and they are regularly broadcast the kind of horrendous things that people will say to somebody down the phone. And often it's because they're worried, but also because they can't get an ambulance, and that's not the call handler's fault.
No, exactly right. Good to talk to you, Alan. Thanks very much indeed. Alan Lofthouse, there, Deputy Head of Health at Unison, with some problems there with if you try to get ambulances, no wonder